The only Okay, so almost everyone is eligible above the age of 18 years. Now the issue is, what about kids? When I say kids, we cannot take it as a broad group of, say, from birth to 18 years. We may have to cut it down into different groups depending upon their needs, their risk for the disease, etc. Okay. Now we all know that so far, according to data available, kids form about 10 to 12% of the total affected cohort. Generally, the risk of severe COVID, hospitalization, being in the ICU, getting ventilated, and unfortunate deaths are far, far lower than what is being seen in adults, except for a small group of children who have other medical conditions which increase their risk for complications of COVID. Otherwise, in general, it's been a mild illness. And even in the second wave, where there was an explosion of numbers, if you take as a percentage of the population, children were not more affected compared to the first wave. Numbers, yes, but not as a percentage of the total number of cases. So from that point of view, the need for a COVID vaccine in children may not be as acute, as urgent as it is for the older population, where the risks are very high. Okay, but at the same time, saying that the vaccine is not necessary for children will be an overstatement, because to return to normalcy, to return to schooling, which I think is an extremely important aspect of a child's life, vaccines are going to play a big role in making this happen. And secondly, we are also talking about herd immunity. When you say herd immunity, a very large population should get immunized. Children on the whole in our country, those below 18, constitute almost about 32% of the population. So unless we immunize this population, we can never hope to achieve herd immunity. From this point of view, I think vaccination of children should be considered in the proper perspective. Jagdish.
Yeah. Thank you, Dr. Kasi. That was a wonderful overview of what is happening right now. What I'm going to do is to try and break this whole thing into 3 segments. What has happened in the past, where we are now, and what is going to happen in the future. And if you look at the past, we have had basically almost 1.5 years or more of this disease in the population. We know that the primary target of this population is the elderly. Children are not so badly off. We have had, again, as Dr. Kasi mentioned, about 12% is what children are affected in any pandemic. And luckily, we have not seen serious disease, excepting for that small cohort of children who will end up with either severe COVID or MISC, or the complication of COVID. These are the 2 situations which are there. However, to caution the public, I would say that we still are in early days. We do not know the long-term repercussions of COVID in children. We know only what is happening in the short term. So therefore, we know that COVID has got a lot of effects other than the respiratory complications, where we do not know whether this lands up with more problems later on. So that's what is our experience. So the models we are working on are limited. So what we need to look at is, as Dr. Kasi mentioned, the new normal, or where are we going to go from here? Are we going to go back to what happened in prior to COVID, prior to 2020? I doubt it. COVID is now our partner. COVID is going to remain in our community. It is not going to disappear so soon. Whichever vaccine comes, whatever happens, however implementation you're going to do as far as public health is concerned, COVID is going to remain in this world, because there are going to be pockets of vulnerable people, either who are not vaccinated, or the virus becomes, mutates and becomes a more pathogenic virus and affects even those who have already had the disease or vaccinated. So therefore, we are going to be with this condition. So now, within the ecosystem of a virus which is going to be there for a long period of time, how are we going to give the best to our children? That's the best thing, because ultimately it's going to be always a trade-off. There is going to be a small risk, no doubt. of children going back to school. They are going to get COVID, but how many of these are going to be severely affected? We don't not send children to school because there is going to be a bus accident. A bus accident can happen anytime. You see, we send children through buses. We send them. There is some risk. This risk, unfortunately, because of the media, because of the hype, because of COVID being at the centerpiece of all conversations, parents are extremely apprehensive of sending children to school, thinking that something is going to happen to their children. But I think what they need to understand are two things. Ultimately, it's always risk benefit that has to be weighed by everybody. Whether you are going to be a public health person, a doctor, a parent, a teacher, or anybody else, the first thing is you need to see what is the risk, what is the benefit. And we have seen that the risks in children are small. Yes, they are there, but they are small. And let me assure you that we have a very robust healthcare system, at least in Karnataka. And Dr. Kasi is one of the lead members who have looked at developing the module for training people. So what we know is that we have a very robust 3,000 pediatricians across the state, and in the country close to 30,000 pediatricians. So we are there to take care of these children, and we definitely will handle whatever emergencies happen. So I think the important thing is that there has to be trust in the public. Yes, there is a risk, but this risk can be mitigated by many methods. One of it is having trust in the medical care system. Two is vaccinating all the adults so that there is no spread. And as the licensing takes place for children, vaccinate children. See, right now, as far as the vaccines for children are concerned, we have very little data from this country as yet, and that's still coming in. So we will get, so therefore we need to be sure that these vaccines are not harmful for our children. Because again, these are new vaccines. So therefore we have to tread cautiously, however, not too cautiously and say no side effect at all from the vaccine. No, that's not possible. There is going to be some side effect somewhere. But the issue is it beneficial for the large population? That's what is very important. So I think what we need to do is to put the whole thing into perspective. And let me also tell one more small bit, that this perspective I am saying today, okay, is applicable as of now. How this disease progresses in 3 months' time, how the vaccines are licensed 3 months' time, what side effect comes, what mutations come, nobody can predict. And this is always an open field. So I would suggest that we keep a close watch on this virus, keep a close watch on the vaccines, and see that we take a reasonable risk. Okay, being fairly comfortable that we have got a good healthcare system which will handle it and can take care of any eventuality if it happens. So I think these are things that we need to reassure the public that it's not all that bad. Okay, yes, you hear so many horror stories, but I think we should stop looking at all those, Florida deaths and Florida this thing happening and all those things. They're okay. They're in a different ecosystem. So I think let's look at it more from our perspective.
Thank you, Dr. Kasi and Dr. Chinnappa, for your opening thoughts. And you rightly said, COVID is unfortunately a partner for us now in this ecosystem, and we have to learn how to navigate through it. And there's definitely a conversation about evaluating the benefits and the risk of vaccinating children as well as reopening schools, which is closely linked. And interestingly, Dr. Kasi mentioned returning to normalcy, and we'll come to that in a bit. But first, to go back to whether or not children need to be vaccinated, there have been also results of antibodies being developed within children. And there was a report day before yesterday by the government saying that children with comorbidities will be first prioritized for vaccination. So just wanted to quickly understand that within children also, are there priority groups that will be looked at for vaccination? And also keeping in mind that children between the age of 0 to 12, are they at a lower risk compared to children at the age of 12 and above? So what will be the priority groups and what is the level of vulnerability between children when they'll be considered for vaccination?
Right. Shall I take it, Jagdish?
Yeah, please go ahead.
Okay. Now, like adults were prioritized when the immunization program began. So it began with those above 65 who are really high risk for COVID, even without comorbidities, and those above 50 with comorbidities. Similarly, children also, given the shortage of vaccines, the non-availability of vaccines, prioritization is necessary. The first group which will receive it on a priority basis are obviously children with other medical conditions. Children who have chronic cardiac diseases, chronic lung diseases, diabetic children, children with kidney diseases, children with immunological deficiencies, severely malnourished children. These are all the priority groups who will be prioritized for the first phase of vaccination. This is irrespective of the age of the child. Now, once this group is covered up, next comes normal, healthy children. How are we going to prioritize them? Here also, we must remember that if you look at the risk of complications of COVID, we are not talking about COVID infection per se, but the risk of complications. That is a drain on the medical system, and that is what we are looking at. That is very high in those below 1 year of age, drops rapidly, and then starts increasing somewhere towards adolescence. And especially during adolescence, with lot of risk-taking behavior, the refusal to follow norms, that rebellious behavior, the high incidence of obesity in adolescents. Obesity is a very, very big risk factor for complications of COVID. The adolescent age group will be next in priority. When I say adolescent, I mean probably from 12 to 17 years. Okay. And then we can come down to the other groups. This, in my mind, no one has really, laid this down in black and white, but I feel this is the way it will be prioritized as long as there is a shortage of vaccines. These are my thoughts about the prioritization. Now, we also asked about the need. Shall we take that later? Just let Jagdish comment and then we can talk about the need.
Sure.
Yeah. I think Dr. Kasi has covered it beautifully, that we have to prioritize because the disease spectrum is very different at different ages in childhood. If you look at the severity of COVID, it's more seen in infants and in adolescents. The rest of childhood seems to be relatively spared. So what we need to prioritize are two things. One is, as Dr. Kasi mentions, the 12 to 18 year age group. That's one group we need to quickly vaccinate for various reasons. The other is also we must encourage pregnant ladies to take the vaccine and also the mothers who are breastfeeding, so that there is some degree of antibodies being passed on and that could protect infants from getting COVID. So I think that should also be a priority. We also know that pregnant ladies have got a very bad outcome with COVID. So therefore, they need to take the vaccine. They have a high incidence of prematurity and even mortality. So I think it's important that pregnant ladies take the vaccine on priority. Now, the next question is, as Dr. Kasi mentioned, within the childhood, those who have got comorbidities. He mentioned obesity, very, very important. Also those with chronic diseases, etc. In addition to that, we have made a recommendation that children who have got difficulty in reaching a medical care, like for example, where triaging is difficult, there are some districts which have got logistic problems. They should be prioritized because you cannot get medical help quickly or transport them quickly in case they deteriorate. So those are also children who need to be looked at. So maybe you could prioritize giving a child in Bangalore a little later than giving it to them. So I think those are also the government policies which should look at the public health implications of vaccination. So these are some things in addition to what Dr. Kasi mentioned.
Right.
Right.
So, sorry, go ahead, Dr. Kasi.
No, that's all. You can, I think we were talking about do children really need the vaccine? I think that was what you were interested in.
Yeah.
Well, one, I mean, to put it very simply, yes, children do need the vaccine. There's no doubt about it. But I would say that in a situation where there is ample vaccines available, okay? Now, as we just mentioned, both Jagdish and I, the risk of complications of COVID and the need for utilization of healthcare resources is least in children compared to the other age groups, okay? So in a situation where the disease does not cause much of problem versus giving a vaccines whose safety over the long period, long-term safety issues are not resolved, here we got to look at the benefit-risk ratio. This benefit-risk ratio is very much in favor towards benefit as long as the older populations are concerned and populations with medical conditions. But with normal healthy children, this has never been looked into. Okay. We have to be careful because we are seeing newer and newer, adverse effects of vaccines which are coming out. Now, for example, with the Astra vaccine, we saw the effect of thrombosis at different sites. With the mRNA vaccines, reports of myocarditis, especially in the younger populations. And these were not known during the initial trial phase, where only a small number of subjects, 25, 30, 40%. Now here it's being given to millions. And so adverse effects, which are not very common, are now getting, unraveled, and we are realizing these problems are there. And maybe over a period of time, say over 6 months, 8 months, 1 year of the vaccine, we may know some of the little longer term problems associated with vaccines. So the risk benefit ratio is not as comfortably placed as it's in the older population and people with comorbidities. That is one thing we need to remember. The second issue is, in a situation, in an infection, which does not cause serious morbidity and mortality in children. However, if children are responsible for spreading the infection to others in the household, then it is worthwhile vaccinating children so that they don't catch the infection and they don't spread it to elders, those who are more susceptible to complications. As far as COVID is concerned, there is sort of uniformity in opinion that children are really not important drivers of transmission. You see, for various reasons, they have done what is known as contact tracing studies. You get one COVID in the house, they look at all the contacts, whom did they get it from? And in majority of the studies, they have shown that it is usually not the child who has brought in the infection, but an adult who has infected the child. So children are not the index case. The second issue is school opening was done in UK. Immediately after the first wave came down, sometime last June, July, they started opening up schools. Yes, they had a temporary increase. They had outbreaks, mini outbreaks in the schools. But what they found that the majority of the outbreaks, the infection came from the staff. Staff to staff infection was very common. Staff to students was next common, but student to staff was very rare. So children don't usually drive the infections. Okay. So for these reasons, children are not considered important transmitters of the infection. This is in contradiction to influenza. So influenza is another disease which is very similar to COVID, at least as far as the virus is concerned and the route of spread and the age group involved also. But in influenza, children definitely transmit the infection to adults. So children are the prime targets for immunization. In fact, countries like Japan have reduced the influenza in their adult population by just immunizing the children and not the adults. You see, so there the situation is totally different. There's a great need to immunize children. Now, the third thing we need to keep in mind is, especially in a situation where there's shortage, is there someone else who needs the vaccine more than the child? And if you look at that dispassionately, yes, there are a lot more people because we are still having a shortage of vaccine.
Right.
On the other hand, as I said, till the child is vaccinated, no parent will be comfortable sending the child to school. Okay, that assumption may not be totally right, but definitely in my own practice, every mother asks, when is the vaccine going to come for the child? So parents will not feel comfortable sending the children to school without vaccination. So return to normalcy or near normalcy will not be possible till schools begin, and schools not will begin till immunization is given to the children.
Right.
Okay.
Very interesting, Dr. Kasi, you mentioned the vaccination of children and the school reopening and what's the concern of parents. And we'll move to that side of the discussion now because parallelly there has been a dialogue of reopening schools. As we speak, 14 states and union territories have partially opened schools in one manner or the another. And children have started attending schools. Now, there's a faction of parents, educators, and civil society organizations who feel that schools should be reopened because there's a colossal academic, nutritional, socio-emotional learning loss that's happening amongst the students because the schools have been closed for a very long time. And then there's another faction of parents, as you mentioned, who are concerned about the safety of children because they feel that would schools increase transmission and infection rates if the children are in those schools? Is it possible to maintain social distancing, especially amongst younger kids? Is it possible to, feasible to expect children to wear masks throughout the day, or expect that the transmission will not happen when they are in the same classrooms or playgrounds, sharing the same wash facilities in the school? So I just wanted to quickly, put you accountable for those thoughts. As to, do you think that children should be fully vaccinated in order to attend schools, or the process can go parallelly? Because as you mentioned, that what is more important is the teachers and the staff to be vaccinated, which is one of the many recommendations that people who are advocating for school reopenings have shared, that the teachers and the staff should definitely be vaccinated. So what are your thoughts on vaccination of children and school reopenings? Should that be one after the another, or could go simultaneously?
Jagdish.
Yeah. Well, I think Dr. Kasi has given a lot of insights into transmission, and therefore we should start from there. Well, it's not feasible to get all children vaccinated prior to attending schools. So this is not possible. Again, we have different kinds of schools. We have the private schools, the government aided schools, and the purely government schools. So there are different schools categories. So I think what we need to do is to look at opening schools based on local epidemiology. Now, like for example, if your infection rates are high, let's say we had a situation in Bangalore like what we had in May, June. At that time, it's foolish to open schools because the virus is raging. Your RO is really high. Your transmission is going at a very high rate. So you cannot open schools at that time. But right at this moment, we are at a lull. The cases have come down quite drastically, quite dramatically across the country and even locally. So I think what we need to do is to open schools depending on local epidemiology. And if you find that the caseload is low, your RO is low, you can definitely go in for opening schools, even if all children are not vaccinated. However, the benefit of opening schools in the government sector is far outweighs the benefit of opening in higher classes, in private schools. And the reason for that is children in government schools are challenged because of lack of technology, no food, and basically social issues. So I think it's very, very important that schools open in the government and government aided schools far ahead of private schools. In private schools, there's a lot of, this is a question of ethics. Ultimately, an ethical issue in a government school is primarily justice, maximum benefit for maximum people. Whereas in the private sector schools, it's the overriding ethical this thing is on autonomy, what the parental choice is. So there are totally different aspects to this. And I think the government needs to look carefully into both this, because ours is not a uniform country like the United Kingdom or the United States. The social problems are different, educational problems are different, and everything else is in a different plane altogether. So I think we need to customize our solutions based on our problems in our country. And for that, what we have recommended is that go local. Look at the district, look at the transmission, look at the prevalence, look at how the adults are affected, and based on that, decide whether it's a government school or a private school, and then decide whether you want to open or not. So I think these decisions too should be taken after looking at all the stakeholders. It's not only the medical system that's going to tell you open schools. It's going to be also the teachers, the parents, the education department, everybody is involved. But one thing is there, when you're opening schools, we may not be able to maintain, social distancing. We may not be able to maintain masks, but at least get everybody who's in contact with children vaccinated. See that the parents are vaccinated. See that the elderly in the house are vaccinated. Because we know, yes, whatever vaccine you give them, it cuts severe disease down. And that is what we are interested in. Okay, infection may take place, but the severity of the disease is definitely modified by vaccination. So, and that's what we need to look at.
Yeah.
Dr. Kasi, anything from your side? Yeah, please.
Yeah, I think Dr. Jagdish has covered up very well, quite comprehensively. So the important thing is school reopening should be done when the community transmission is very low. And some figures are given when your test positivity rate is less than 5%, it's a comfortable time to reopen schools. Every person in contact with the child in the schooling process, right from the bus cleaner, the bus driver, the person who opens the gate in the school, the ayahs, the teachers, the principal, everyone should be immunized. And people at home, people with comorbid conditions, the elderly, grandparents, everyone should be immunized. That is extremely important. If we wait for immunizing all the children to open the schools, I think the schools are never going to open, at least for the next couple of years, because we will not have vaccines to immunize everyone, at least for the next 2 to 3 years. Now, again, a very important point was brought out by Dr. Jagdish regarding the private schools and the government schools. We must remember the government schools is an important source of nutrition for children. They get one meal per day. And for many children, that's the only good meal they get in a day. In fact, closure of the schools has given rise to a terrific increase in malnutrition, vaccine preventable diseases, because schools also form some sort of a focus for immunizations. All these have taken a backseat. Children who have special needs, they're dependent upon counselors in the school. They are the children who are also suffering a lot. So I think we have to look at the private and the government schools with totally different lenses and take individual decisions. And as Dr. Jagdish said, it has to be a local decision. The orders cannot come from Delhi. It has to come from each individual district or taluka only.
Thank you, doctors, for your very valuable points. And you're absolutely right, Dr. Kasi, talking about the nutritional loss, which is sadly not being as heavily discussed as it should be. The figures indicate that 35% children did not receive any kind of meal. And the ones who received even take-home rations could not get the nutrition because the ration was divided within all the family members. Absolutely, the government schools do have often not just education, but the health safety nets that the children are being deprived of. We have opened the chat for some questions, but before that, we just have one last question in the thread, wherein as schools are being reopened, we see some children being infected. There are cases coming in, and the immediate response of the state governments is to temporarily shut down schools again the moment there's an outbreak in the school campus. Now, my question to you is, what should be the advisable recommendations to schools and school authorities if there's an outbreak or if there are some children who get infected once they reopen schools? Should they go back to temporarily shutting them down, or could there be some preventive measures and post-outbreak measures that the schools could take?
I think we can prevent a lot of this confusion if we have well set up protocols before the schools reopen. What is going to happen if a child develops fever in the school, or a child who comes to the school, the teachers realize that the parents have got COVID, but they've sent the child to school? So in such situations, the closest contacts need to be isolated. Apart from this child going into isolation, the closest group has to be investigated, quarantined according to whatever standard protocols are there. A knee-jerk reaction like closing down the entire school will be counterproductive, because if you have multiple classrooms in the school, probably the immediate neighbors of that particular child are highest at risk. The entire class may not be at risk, and definitely the entire school is not at risk. So I think this decision of closure should be left to public health officials and not politicians. I think this is what we should do.
I think the whole point is that we have to dispel this fear business which is going on. There is a tremendous amount of fear. If supposing one child is detected with COVID, so what? We don't shut a school because some child has got developed influenza. We don't do that. See, the point is now we have to look at it from that point of view, that we cannot afford to start shutting down schools just on whimsical reasons. As Dr. Kasi mentioned, we have to have very strong criteria. Okay, there is a likelihood of an outbreak because a large number of, susceptible children or susceptible adults, then maybe yes, but otherwise no. And I think, as Dr. Kasim mentioned, we have clear protocols must be there, and follow it up at the local level. Don't worry about shutting down schools across Karnataka. You have one school which has got a problem, you can't shut down the entire district. So I think so. So the point is these are all things which have to be taken under local things. What we have recommended is form a school opening committee with clear guidelines. Let there be a parent over there, a teacher over there, a pediatrician over there, a district health officer, the collector over there, so that the point is there is a uniform response, okay, on what decisions you take. So I think these are standardizations which are required. And again, the the rules and regulations that an American school follows is very different from what is going to happen in India. And let me also tell you that if you go to a let's say a rural school, even a child has got fever, cough and cold, they may not test.
Yeah.
Nobody may test at all, so you don't know whether that's COVID or not. And if you look at the prevalence of antibodies today across maybe few metros and other places, it's very, very high, which means children have already been infected.
Yeah. Yeah.
So I think slowly we are moving into a phase where we are having our children with a reasonable degree of protection because they already have been infected. So it's unlikely to produce, great numbers of children with COVID who are going to need medical attention. It's going to be that one-off case in a school. So don't get too worried about it.
And you rightly, yes, go ahead, Dr.
Yeah, sorry. Can we just have a brief overview of what is going to come in vaccines? Okay. I would just like to just for a couple of minutes because there's a lot of hope about this.
Right.
Now, I think, and press statements come left, right, and center, creating headlines which really don't stand the test of time. It has happened in the past. Now, the vaccine which was alluded to in that health minister statement,
yes,
was a DNA vaccine, which is being tried in children above the age of 12 years. Their study is still not complete. And
yes,
it is mandatory for childhood vaccines, at least 6 months of follow-up should be there before that vaccine will gain acceptance for children. 6 months of follow-up after the study is over, after the recruitment is over. So from that point of view, saying that it's going to come by the end of September, I think is ridiculous. The other vaccine, I won't take names. One vaccine, the Astra vaccine, there are no trials in children at all. They have dropped it totally.
right,
As far as the other vaccines, the Hyderabad vaccine company vaccine, they have initiated studies. Recruitment is going on. So I don't think we'll have any results at least till the first quarter of next year.
right,
mRNA vaccines from United States, both of them have already in advanced phase of their below 12 years trial. Even they don't expect any results to be out or decisions to be taken before the end of this year. So I think as far as India is concerned, we are looking at something only in the first or second quarter of 2022 and nothing earlier than that.
right. Then to pin the vaccination of children and connect it with school reopening is definitely misleading.
No,
for parents
I
and
don't think the
students.
two should be connected.
Right, right.
Or should not be, one should not be dependent on the other.
Right, right. Thank you, Doctor, for that clarification. We have some questions in the chat box as well as in our emails. So we'll be opening the floor to questions from other participants as well. You could write your questions in the chat box. It would be great if you could mention your name as well as whether you're a student, educator, or a parent. The first question, Doctor, we have is for children between 0 to 3 years who are not yet school going, but it's important to have social interactions for them given the first 1,000 days are important. What should parents or pre-primary school do for those children?
Well, you see, between 0 and 3, social contacts are important. Again, you cannot have masking because masking is recommended only above the age of 2 years in some studies and 5 years in some other studies. So the CDC says 2 years and the WHO says 5 years and somebody else says 3 years. So, but usually small children cannot do it. But I suppose within small groups, especially if the parents have already been vaccinated or had the disease some time back, then it's safe to allow these children to play together in small groups. There is no harm at all. So I think we should start encouraging that. There are some preschools also which have opened with limited attendance, where you don't have too many children in a particular class. You have maybe about 5 or 6. and then you know the vaccine status, and you know that the risks are reasonably low in terms of this kind of social interaction. So again, gradual opening of such things should be acceptable. I don't see that we should be very rigid and keep them. I've seen parents with who put the masks on and who put visors on and who put gloves on for their children even at home. So I think those are all kind of carrying things to an extreme, which I don't think is required at all.
Right, right. We have the next question. Maybe Dr. Kasi, you could take that. Despite ICMR recommendations for primary schools to open first in underdeveloped AC receptors in younger children, why do you think states continue to prioritize higher classes? Because as you also mentioned that the infection rates and transmission rates in younger children is very, very low. Is there any way to convince state governments to focus on primary school children who are suffering because of loss of social skills, nutrition, and foundational skills? This is a question from Tanya Agarwal. She's a parent as well as a lawyer, and she's been actively advocating for school reopenings. She herself has a child in primary school. So, how would you respond to her question of convincing states?
Yeah. Thank you. Now, regarding the previous question, I think there are some modules which are available for guidance of patients, mothers, to optimize development of language skills, communication in the 0 to 3 years in this lockdown period. And for those interested, references can be given by both Jagdish and me so they can tackle it. Now, coming to the second part, scientifically, what has been said is true. And in fact, it's not the ICMR, it is Dr. Randeep Guleria, the director of AIMS, who suggested that it makes more sense starting the primary schools because they are the ones who are at least risk for infection and then moving up to the higher classes. Yeah. Scientifically, yes, but I really am doubtful how many parents will really accept this. You see, sending a young child of 3 to 4 years or 5 years versus sending an adolescent who knows what is COVID appropriate behavior and has the capacity to follow COVID appropriate behavior, which is of prime importance without vaccines. That's not possible in the younger age groups. And that's the only reason why this reverse pyramid is not being followed. And believe me, in this age group, a lot of children are asymptomatic. They don't fall ill at all, even if they get infected, but they can go back home and infect their grandparents or parents if they have diabetes, etc., and cause havoc. So these are some of the arguments against starting with the primary schools and still persisting with starting with the higher schools, where you can insist on certain discipline and measures which are COVID appropriate behaviors.
I think I will just come in here, and I think what the question raised is very valid, and I think it's basically that small children are rarely affected very severely, and therefore we should look at least in government schools to start opening for smaller classes for younger students. And the reason is those are the ones who are going to land up with the bad effects of nutritional deprivation. So I think the important thing is to see that whether we can start the government schools for small children quickly. Okay, you can have the luxury of opening it a little later for all the private schools. That's fine. But as far as the government and government-aided schools is concerned, please open it for small children quickly. It doesn't really matter. Nothing is going to happen.
There was also a recommendation made by several civil society organizations, including us, that for primary school students, if not opening the classrooms, can we open playgrounds? Can we do it alternate days, wherein forget academic loss? Can we just at least open playgrounds on alternate days for 2 hours where children could be fed nutritious hot cooked meals to cover for that nutritional loss, and then look at what the transmission rates are and what the ground situation is to further take decisions on the same as well. But the challenge here is that nobody is reimagining school openings. Everybody is going back to the former models without any protocols and guidelines, and that is where the challenge is coming with states as well. We have another question very closely linked to what Dr. Kasi said of parents not having the confidence to send a young child to school. This question is from Gautam, and he says that how should we address the emotional aspect of the parents who will be extra cautious while sending their children to school?
I suppose, see, every parent is going to say that, can the school guarantee and the government guarantee that my child will not be affected? Well, nobody can guarantee this. Okay, so it's a trade-off. As I mentioned in my opening remarks, it's a trade-off. And every parent has to accept this risk. And they have to accept this risk. See, after all, if you're going to take your child to a swimming pool, this child is not going to get into the swimming pool. Neither would you want to get the child into the swimming pool in a hurry. The child is going to cry, going to refuse, going to do everything else. The same analogy holds here. You see, the parent is so scared of sending the child to school. This fear has to be thwarted somewhere. And I think it's very important that the government, the policymakers, the school people, professionals, doctors, etc., and everybody else have a uniform voice saying that schools have to open. You cannot keep waiting forever for the COVID to go away, everybody getting vaccinated, bringing down the risk to zero. Never, it's not going to happen. So I think by the time that happens, a lot of water would have gone under the bridge. We would have lost a lot of time, and lot of issues with our children are already happening. Psychosocial issues, nutritional issues,
Yes.
So many things are getting affected. So I think it's important that we look at it from multiple perspectives and take a considered decision.
I think we should have very good protocols set up. The parents should be involved in these protocols, setting up these protocols, should be made aware of the protocols. So the parents are confident that all possible measures are being taken to prevent the child from getting infected. And unless the parents are taken into confidence in this regard, nothing will materialize. There's no idea of some central authority creating protocols and imposing it upon the schools. Parents have to be part of this decision-making process. Only then will the confidence come. I mean, let me tell you, when the whole thing began in March, I think Jagdish also will vouch for this. We had empty clinics. No one was willing to come to our clinics. Okay, because they were scared they will get infected. Over a period of time, we all set up certain protocols, for seeing children in our clinics to minimize the risk of transmission in the clinic. When the parents came to know about it, gradually they started bringing their children to the school, to the clinics. And I think something similar will happen too in schooling also.
Very interesting, Doctor. You mentioned this point. A follow-up to this would be, what would you suggest the government or the civil society organizations could do to educate parents about the benefits associated, which outweigh the risk associated with sending their child to school? Like, there was a very active polio campaign that was done in the country, and we definitely saw an increase in the immunization percentages. So any recommendations or suggestions you would give to the government as well as the civil society organizations to bust the myths associated with sending their child to school?
I think first is, as I just said, the parents have to be confident that by sending their children to school, the children are not going to be at unusually higher risk than staying at home. Even if staying at home is not risk-free, there is always a chance it can spread. And this can be done by establishing good protocols. So these protocols have to be set up by people in the know-how about setting out protocols about disease transmission, public health measures, and parents also should be informed about the reasons for making these protocols, how the protocols are going to be enforced. See, all these things, discussions have to be made. And as I said, we need not really think of a central authority. We can do it at either a state level or a city level also. I mean, there's a lot of, what would I say, qualified people to do this. The only thing, all of them have to be brought together and you got to have one protocol to be made. I'm sure that will happen. The second thing is, I think we really need to educate people about the realities of COVID. I mean, there is so much of sensationalism regarding this third wave, and it's really creating havoc. And I think the general consensus is, yes, the third wave will come. Maybe children may be affected more, but there's no reason why children will be more severely affected. I think these are the things where the opinion makers have to talk about in the media to, raise the level of confidence of the parents in sending the children to school. Believe me, if you take the history of any pandemic, usually the second is the worst. And then it starts becoming, the Spanish flu was the same. The second peak was the worst. The third and fourth became much less. Okay, so these are things we got to draw lessons from the past and convince the parents that, well, maybe the worst is over and we are not going to see such bad times again. Jagdish, anything?
I think the most important thing, as Dr. Kasi also mentioned, is that we need parents to move away from fear to courage. I think that mental shift should take place, because right now it's all fear, because of media, because of messages, because of whatever that's going on right now. All parents are in a state of fear that something will happen to their children. It's kind of catastrophic thinking which has overtaken the entire population. And I think that has to change to saying, yes, this disease is there, it's going to be part of our lives, and we'll have the courage to fight it, because we've got the right ammunition. We've got testing available, we've got the medical system available, we have vaccines available for adults at least. Okay, so I think what we need to do is to look at the data a little more carefully and say, move away from this unnecessary hype that COVID is going to do something to your children.
Right, right.
I think
but unfortunately, the fear,
that mental shift has to take place.
Definitely. And unfortunately, the fear far exceeds the data that we currently have with respect to how COVID affects children. But this is another follow-up question on the fear aspect that you mentioned, which is definitely hyped up by media as well. So Tanya is asking that, do you think testing can be a mitigation measure? If we test as aggressively in schools as we do for adults, do you think that could be one measure where we could, bring in more facts and figures as to what the ground situation is?
Yes, absolutely. And I think a very valid question. Testing is extremely important, because only by testing you will know two things. One is you will know what is the disease prevalence in the community. And second thing, you will also know if there are going to be variants that are emerging. I think so. Testing is a very important part of of surveillance, and I think it's very, very important that in schools, in fact, certain schools in the US do testing twice a week on all the school teachers and attendants and everybody, to see that nobody is infected. So I think the point is that with availability of simple, tests which can be done by the school staff themselves, you don't need to go anywhere else. It's self-testing, which is now available now. You see, so schools can invest in this, especially those, the private schools, and they can do the testing to see whether there is any disease prevalence in the school.
I think just to add to what Dr. Jagdish said, I think if we restrict testing only to the symptomatic children, we may be missing out a lot of asymptomatics. And we will never really know the true incidence of COVID in the particular population. So some statistical way in which you can even test asymptomatic children a certain number, so that you get statistically valid reports to say that, yes, this was a rate of asymptomatic, this is the rate of symptomatic transmission. And again, I think I wish to emphasize, when we reopen schools, I think the children with medical conditions should not be grouped up in the general classes. Either they should have a separate classroom so that the infection rate is much less. And I think they should not enter school till children are immunized, because they are at very high risk. I think this is just one add-on point I would like to put.
Right. Doctor, this is a question from Anila, who runs a pre and primary school in Jammu. So she asked that, as you rightly mentioned, that it would take us years if we just wait for everyone to be vaccinated in order to reopen schools. So the protocols are the way forward. But how to ensure that the protocols are complied, whether it's with respect to students or with respect to parents?
It's a very good question. Ultimately, who is responsible for the compliance? See, you cannot have the healthcare authorities coming and inspecting every day. I think this should be an initiative which is from the school and from the parents. And ultimately, this is a game which I think all of us have to play together. It's not as if you cannot say that it's the government's responsibility or the school's responsibility or the parents' responsibility. I think the communication has to be from all groups. They must understand the rules very clearly, and each one must follow his part. Otherwise, you're not going to reach anywhere.
Right. Thank you, doctor, for that response. We also have a question from a parent of a differently abled child, and the parent asks, is it healthy for a child to wear mask for a longer period or a prolonged period of time?
Studies have shown that masking does not reduce the oxygen levels in your blood. Okay. They have done that even in athletes who go for little more vigorous sports. There is no drop in oxygen levels. But we must remember, in a differently abled child who may not be able to remove the mask when necessary, in such children, I think there has to be supervision. But in general, masking is safe. Now, what do you mean by prolonged periods? Once we reopen schools, we are not going to have 8-hour schools.
Right.
It's going to be for much shorter periods. It's going to be maybe for 1 hour for the primary children, maybe for 2 hours for the middle schools, and maybe about 4 hours. So at the most, maybe 4 hours of masking, and that is definitely not harmful.
All right. Thank you, doctor, for that question. There's another question, which is, are children more asymptomatic to the virus? Which I think you've already answered that.
Yes.
But if yes, would that be a risk while we reopen schools?
Well, point is risk of transmission, again, as what Dr. Kasi mentioned, from child to child or child to teacher is extremely uncommon. And again, those who are asymptomatic can transmit the disease, no doubt, but it's definitely much lower than those who are grossly symptomatic because the viral loads are much more.
Right. There's another question, doctor, wherein this is from one of the founders of an organization that works in Haryana, and they have asked, do you think there's a lack of understanding that the health authorities and the education authorities need to work in conjunction when it comes to school reopenings and vaccination of children? Because right now they're operating in silos, whether it's with respect to the protocols or whether it's with respect to the advisories that are being out there. So do you think there's a need for them to come together on this matter?
A wonderful question, and I think this is a basic problem of no crosstalk. I think the right hand doesn't know what the left hand is doing, and that happens in many of our policy decisions. And I think here we have given a recommendation that at the district level, everybody should be at one committee, whether you are from education department, health department, or administrative department, security department. All of you are in one group, and that focus of that group is health of children and reopening of schools. So if we can form that kind of a committee, then I'm sure it can be they can look at it. But unfortunately, I agree with the person who asked the question that in many parts of the country this is dichotomous. Everybody is on a different recommendation. So I think that is a challenge. But I suppose maybe the teachers can unify everybody by calling everybody for a meeting and asking them what is the best way forward.
Yep.
Dr. Kasi, would you like to add anything?
Well, nothing more except that I agree with what Jagdish said. I think you have got to get all the experts sitting on a round table and forming the policies. And it has to be a uniform policy with input from all specialties.
Right.
Including the parents.
Including the parents, definitely. I think all the stakeholders need to come together for this. So before we wrap up today's session, any last thoughts that you'd like to communicate directly, because there will be a lot of parents as well as educators who will be watching this. Anything that you'd like to directly communicate to them with respect to children's vaccination and reopening of schools as your last thoughts?
Well, I think the important message which I feel should go from today's meeting is, one, don't wait for the vaccines to change the world. It's not going to change the world. Okay. It's going to be contribute in some small way to change the world. And as Jagdish so succinctly put it, we got to learn to live with COVID. We have learned to live with influenza. We will learn to live with COVID as well. So whatever proper precautions, standard of procedures are to be followed, we have to follow that honestly and from our heart, not because someone is watching behind your back to see whether you're doing it or no. You see it as if we followed because it has to be followed, and it is a must for ensuring the safety of the child. And of course, the second thing which I said was irrational fears have to go. Don't rely too much on media reports. If at all, the child's pediatrician is always available, or at least Jagdish and I will always be available to clear whatever doubts, confusions you have about the disease. I think we got to look forward rather than go into a cocoon and, just sort of, shelter us from what is really going on around us. We have got to move forward.
Right. Dr. Jagdish?
I think Dr. Kasi has voiced most of what I wanted to say, but I think one single point which everybody, whether you're a parent, whether you're an educator, whether you're a doctor, whether you are a government official, whoever you are, you have to always keep in mind what is the best interest of the child. I think the best interest of the child has to come at all points, because that right cannot be taken away. And today, that right is going to be different for different children. For a child who does not get food, the best interest is to get food into him. Don't worry about COVID. COVID is not going to kill him. Malnutrition will.
Yeah.
The spread of other diseases will. So vaccination, nutrition is important. For a child who is getting a good amount of, let us say, family time and education through whatever Zoom, etc., etc., it's not so critical when you're going to open school, because anyway he's having his education, his social, etc., going on. But again, there also, what I would say is look at the best interest. See, the best interest in that child is some degree of socialization, some degree of nutritional restriction, because we now have an epidemic of obesity in children sitting at home and on Zoom. So therefore, I think parents need to keep looking at all this. And the sad part of it, parents don't notice this, because it's been creeping up on children over the last 1.5 to 2 years. So I think keep a watch on the child as a totality, because it's going to affect. See, I'll tell you, the psychosocial issues of this pandemic are going to remain long after we get rid of, COVID or getting into schools. So I think these are things that we need to look at more carefully, pay close attention to your children. And I know one principal of a school who just gets 2 or 3 children into her school every day, just to play with them, just to keep them in good mood, just to talk to them as to what the nutritional aspect should be, what they should take care and study, and etc. So I think the point is we have to start moving more from this technical, ideas to basically simple things of what is the child's best interest. And if we can all do that, that should be more than enough. Vaccines will come, God knows when. COVID will also affect our child somewhere down the line. All of us are going to get COVID. Whatever masking you do, whatever you do, all of us will get COVID somewhere down the line. Okay, because this virus is not going to go away anywhere. So I think if you are going to get it, we have to be, we must be prepared to face it, not fear it and run away. So I think those things parents will have to, get clarity on. Move away. Don't get afraid. Okay, have some courage and start looking at sending children to school.
Absolutely. On that note, I think we'll conclude today's very, very enriching discussion. We are very, very grateful to both Dr. Srinivas and Dr. Jagdish for joining us today. I am very sure that your words would have given some amount of assurance to parents, to teachers out there who are also looking at their child's future being put at stake in the wake of COVID. And we hope that people take this into consideration and we see more forward-looking measures of safe reopening of schools. We're very grateful for your time, and thank you so much for offering to address our concerns. If we were not able to answer anyone's questions, or if they have anything that they would want to ask both the doctors, you could reach out to us at info@intersaction.org, and we'll definitely relay your questions to both the doctors. And once again, we are very thankful for your time. Thank you so much.
Thank you.
Thank you. Thank you. We enjoyed it as well.
Thank you. Bye.
Thank you.